Hello, I'm Dr. Andy Goldstein. Welcome to the Arizona Heart and Lung Surgery website. You probably came here because you're trying to find some information about me, or perhaps you want to get some information and answers about heart, lung, or vascular surgery. Either way, I hope by exploring my website, you get some answers to the questions you're looking for. My career actually began as an aerospace engineer on the NASA space shuttle. I was a hydraulics engineer, and I became very interested in the hydraulics of the human cardiovascular system. About 25 years ago, I transitioned into medicine, only to find out that what I loved about medicine was not the engineering aspects, but the ability to interact with people, and even though it's a bit of a cliche, be able to help people who were in great need. I went to Columbia University, a College of Physicians and Surgeons. I completed my general surgery residency at the University of Rochester, and then my cardiothoracic surgery residency and fellowship at Yale University. Along the way, I developed and ultimately patented a mechanical heart assist device that today has been used in over 1,500 patients worldwide. After completing all of my training, I left Yale and joined the faculty of the Ohio State University Medical Center, and there I performed all manner of heart and lung surgeries, including heart transplantations and artificial heart device implantations, including the device that I had helped to develop and patent years earlier. Over the past 10 plus years, I've performed well over 1,000 heart operations, well over 1,000 lung or thoracic surgeries, and hundreds of carotid surgeries. And one of the nicest honors that I've received is being voted one of the best doctors in cardiothoracic surgery in Phoenix magazine based on voting by my peers. It's very important that surgeons be confident and not trying to be coy. And I believe that I'm outstanding. And I do believe that I'm one of the best. But it's also important to have some degree of humility. I can tell you that in order to serve our patients better, surgeons do track their outcomes. And an important question to ask, either myself if you come in to see me or another surgeon, you want to ask how often does the surgeon perform this procedure and what kind of results they've had. And these are fair questions, and you shouldn't be intimidated from asking these questions. I'm always a little bit surprised when I talk to a prospective patient, or I'm just about to take somebody to the operating room, and the patient or the family member will say, "Will we see you again?" That amazes me, because once you become my patient and once you've had surgery, I feel like I am completely responsible for you, and I can't conceive of the fact that I would not come back and follow up. For these more complex operations, such as major heart or lung surgery, patients can have many different specialists, many doctors coming and going, that it's very hard to know exactly what you're supposed to do. You get a lot of different information. You're told to see many different people, get many different tests. It can leave your head spinning. And you need a coordinator. You need a commander-in-chief. I can tell you, and my former patients will tell you, that if you become my patient, I will assume that role. I think too many patients leave the doctor's office and say, what did he just say? What did she just tell me? I would never want one of my patients to leave the office and not understand the basics of what we had discussed. Sometimes surgery is not the right thing. Sometimes there are better options. Sometimes surgery is too much. There are patients who might not be able to tolerate an operation. There are also patients who might do better with medical therapy. Regardless, I will always tell a patient what I think is best. It's very common for patients to ask me, what if this was your mother or your father or someone in your family? I can tell you that I never give advice to anyone, and none of my patients will ever get advice that I would not give to a family member. It's very difficult for you to pick up on these subtle but very important factors that we're discussing here on this video. All I can tell you is that if we do have the opportunity to meet, I believe that that level of trust will immediately be established.